Ladies and gentlemen, we will now begin with our fireside chat segment with our distinguished guest, Dr. Donald Berwick, titled The Value Proposition of Broadband Connectivity in Health. This fireside chat will be conducted by Dr. David Ahern. Dr. Ahern, please proceed.
Thank you, Ben. It is a distinct honor to invite Dr. Don Berwick to join us in a chat today. Dr. Berwick is President Emeritus and Senior Fellow, Institute for Healthcare Improvement on the faculty, the Department of Healthcare Policy at Harvard Medical School, and former administrator of the Centers for Medicare and Medicaid Services. He really doesn't require any introduction. He is a true giant in the field of healthcare quality improvement, safety, and really joins us today to talk about the potential of broadband connectivity to enable health and healthcare in ways that really bring value. And this is a major focus of Don's work. I've had the pleasure of working with Don back to his participation in the President's Cancer Panel workshop in 2015 that led to the report on improving cancer care through connected health that was presented to President Obama in 2016. Subsequent to that, Don became a friend of the Connect to Health Task Force and participated in a fireside chat in 2018 at the Connect to Health Conference with Don Norman and Susanna Fox, and subsequently played a really key role in 2019, the summer of 2019, as our moderator for our senior leadership think tank event in Washington, D.C. at the FCC that really highlighted the important role of connected health, particularly focusing on cancer and rural care and access to care. So with that, I'm going to kind of go back to the term value and ask Don to talk about how he perceives broadband connectivity in the context of value, particularly as we also consider the construct of social determinants of health that's now emerging in our conversations in healthcare. And so, Don, let you take it away, and then you and I can have a conversation.
Thanks so much, David. Let me make sure you can hear me okay.
Yes.
Great. Well, I really appreciate the chance to join you and to connect again, to Connect to Health, and thank the FCC and your colleagues at MITRE and others for the chance to think together with you. A couple of quick remarks. I guess the first thing I want to say is how excited I am. I think that if ever there is a matter whose time has come, this is it. For my entire career, I've been trying to help healthcare globally just get better. There's so much we can do better for people. And, we've learned a lot about how to do that, but we haven't cracked what I think is I think it's the Nobel Prize issue in improvement, which is scale, how to be able to reach everyone, everywhere, all the time. And I think this is the answer. And I don't think I'm being naive about that. I've seen connectivity come and go and through the years, but this feels real to me. So value, I think when we're pursuing improvement, doing better for people and conserving resources, I guess there are two domains we might want to be thinking of. One is care for people who are in care, people in hospitals, people sick, people who need to be reached. And there, I think the quest needs to be to get everyone access to the best care in the world. I don't think that's an unrealistic goal. I think you and I talked, David, in preparation here about what I think I phrased the democratization of excellence. Everyone can get the best. The launch project, the cancer project with NCI and FCC that I got to participate in a bit was a great example of that, which is how to really break through barriers of connection of people to the best knowledge and action. And this is the way to do it. I'm absolutely convinced. On the social determinants side, which is the other side of the coin, that's really about creating health and protecting people from illness, injury, and disability upstream with working on social determinants. the one thing I'd like to say before we go back into dialogue is that's really crucial. Healthcare doesn't create health. Healthcare is a repair shop, and so most of the illness, injury, and disability we deal with is generated outside the care system. And we know scientifically how much illness, injury, and disability can be mitigated or prevented when we work upstream rather than waiting for the problems. I think for this seminar and for planning about social determinants, it might be helpful to be clear about what we mean by social determinants. It's already been discussed by some of the preceding speakers and will later today. The sort of reference document for me is the work of Sir Michael Marmot in his amazing book, The Health Gap, which I would recommend to anyone to read. It's written in 2015. The Health Gap is a book that pulls together scientific data on what creates health and wellness and illness, injury, and disability. Marmot has 5 categories, and that's what social determinants needs to mean. Let's follow the science. The 5 categories are quickly early childhood experiences. What happens to kids when they're really young has a lot to do with what happens to them as adults with respect to health. Second is the education system, how robust it is, how much access there is to great education. Third is workplace conditions, supports to the workforce. The fourth is supports to elders, supports to aging people, especially to avoid loneliness. And the fifth is community infrastructures, transportation, food security, housing security, criminal justice, violence prevention, recreational opportunities. Those are the 5. That's what, when we say social determinants, we should mean early childhood, education, workplace, elder supports, and community infrastructures. Marmot has a 6th category, which is extremely relevant to this conference, which is, he asked, what's the driver of those 5? And his driver is fairness, equity, a commitment to solidarity. In a sense, everyone's in. And if you ever want to pick a tool for getting everyone in, this is it: connectivity and broadband. So I can't think of more power here. The challenge to those of us in this meeting and for the future is, how can broadband help us in the healthcare enterprise connect much more effectively to those 5 areas of social determinants? And I think I can't think of a more exciting question in terms of pursuit of well-being for communities and individuals. So that's big, much more a lecture than I intended, Dave. But we got 2 topics: how to make care better and how to make health better. And both broadband offers leverage.
Don, that is fantastic. It really, we haven't, I would say, collectively within the task force, thought about the way you framed it in the work in the book that you mentioned, Dr. Mom. That book, we will definitely look at that. I think that does provide a way forward, because we're trying to position the idea of broadband connectivity in the sort of evolution of care, not only care, but also health. And so we really are looking at it broadly. And you mentioned equity. So the other sort of common concern now with the pandemic, especially, is the systemic structural inequities that we have, certainly in our healthcare delivery system, and we have in society at large, but within healthcare in particular. And as you know, some of the concerns about technology and broadband access and internet access and so on is that, and we've heard some of it from prior speakers, that there's the risk that we can actually increase disparities. For those individuals who have access, they may benefit more, and there's a greater disadvantage to those that don't. So we need to obviously be aware of that. We need to address that and make sure that's not the case. So we're thinking in the task force about how do we kind of flip the script and make it much more that this is a way forward, and that we need to have 100% access to broadband for all citizens.
The 100% goal is just right. I mean, why should be anything less? Who would you decide to exclude? But then the narrative, the flip narrative, is to perceive of that as a route to health and well-being. It's not a sidebar idea. It's not like another good thing to do. It is a highway to health, if we choose to make it that. Again, those two ways, by the democratization of access to the best possible knowledge and guidance, and the second is to will require more creative thinking, but like, how can broadband access at 100% help improve, say, early childhood experiences, so as to generate greater health in the population? Your mind begins to spin thinking of what that would look like. And you see, if we just stay in our healthcare buildings, you can't do that. You can't imagine a way that the hospital becomes an agent of improvement for early childhood. But you can think about that in the broadband world. With respect to scaling, by the way, there are cases in which we know what to do, but we can't make that knowledge available everywhere. We've been trying to do it with covered wagons and bicycles, and instead there's better ways to do it. The project that has caught my attention recently is the one that the Department of Health and Human Services launched with ARC, AHRQ, and IHI, the Institute for Healthcare Improvement, and Project ECHO in New Mexico. So here you had IHI and ECHO, and the challenge from the HHS was around nursing home care and protection in the COVID pandemic. There are 15,000 nursing homes in the United States, and as you all know, the pandemic really walloped them. They were the cutting edge sites, second only to prisons and jails in terms of intensity of burden. The challenge from HHS was, could we reach 15,000 nursing homes with support, educational support, so they could mitigate the effects of the pandemic by decreasing incidence of COVID in staff and patients and decreasing deaths in staff and patients. That project, using broadband connections in partnership between IHI and ECHO, in cohorts of 30 nursing homes at a time, it's unbelievable. They reached 9,017, over 2/3 of the nursing homes in the nation, nursing homes in 3 months, with each of them receiving 16-week series of training sessions, attended, embraced, supported by 100 academic teaching centers, and major changes in care processes and outcomes in those nursing homes. So, you couldn't imagine doing that with bicycles and covered wagons, but you can do it with broadband, and did it.
That's a remarkable story and project that I'm sure we'll hear more about. And you're absolutely right. There's an example of where the neediest population, those at the greatest risk during the pandemic, were able to benefit from a broadband-enabled set of services, and following the evidence base of how to do quality improvement in the training that the IHI provides. I wanted to come back to the science reference that you made. I'm a scientist, as you are, and the importance of following the science and the goal of doing no harm. We obviously are still in a very early stage of evaluating the impact of broadband-enabled solutions, the telemedicine, telehealth, remote patient monitoring, virtual care, home-based hospital care. The list goes on, and we'll be hearing from our colleagues in the next panel about emerging technologies that can be deployed to where people are, not where they have to be, outside of their home, perhaps. What do you say about the science? What do we need to do? What's the path forward here to make sure that we do no harm and we do evaluate what we do to make sure that it's effective and it's bringing value?
Well, I hear that's a great question, David. I hear the word science has two meanings here. One is a simpler meaning, which is this democratization of knowledge. Let's take patient safety, since you raised the safety issue itself. On a positive view, we know a lot about how to make care in hospitals safer. There are 6,000 hospitals. We know a lot about how to make care safer in nursing homes, 15,000 nursing homes. We know how to make care safer in ambulatory settings, tens of thousands of those. But we don't have a way to move the knowledge efficiently. We could put it in a journal, but that doesn't actually work. Right? Publishing something isn't it just doesn't, it's not empirically the way to get knowledge out into the world. The kind of connectivity we're talking about now can work. And there's an avidity for this. I think what we saw in a nursing home project, and I think we're seeing it in other projects that I've been involved in. People want to know. There's no like, you're not knocking on a locked door here. Once people know that they can get access to the best knowledge, they want to use it. We're talking about both patients and families and clinical staff. So part of the safety side of this is to get safety knowledge out there. I know that's not the direct question you were asking me, but I could imagine that we could reduce injuries in healthcare to patients simply by spreading the knowledge of safe practices by tens of thousands a year, maybe hundreds of thousands, using broadband, which we don't have another way to do that right now. With respect to the safety of the connectivity, that needs some discipline. Now we're in a kind of festive phase right now in the COVID era in terms of the number of people that got connected and began to use virtual care, for example. We are a little bit behind in understanding how to watch that care occur and make sure that we understand what the nature of excellence and safety in that care system. You mentioned projection of care into the home. That's another frontier. Hospital at home, doing things, having people do things for themselves at home under internet, under web-based guidance. That's all possible. We need a plan for learning as we do that. I would be cautious about applying the brakes on this. I think we should go with the energy, but we can learn if we're disciplined about studying what happens and really dynamically gathering the information as we go, which is, by the way, another potential property of broadband. I leave it to the experts to parse this, but from the viewpoint of quality, care is always an experiment. You say to a patient, I think you have Lyme disease. Here's what we'll do about that. I think you're having migraine headaches. Here's what we'll do about that. In scientific practice, you want to hear back. You want to say, well, what happened? Was I right or was I wrong? And actually healthcare is not awfully good at that, closing the loop back, hearing back from the communities and families and people we help, saying, were we right? Were we wrong? How did we do? I think there's some possibility in broadband connection for this learning process, this hearing back process, that would be a massive step forward in the quality of care. So again, lots of possibilities here, David. Let's learn as we go.
Don, that's fantastic. Yeah, as you talk about the feedback loop and the involvement of patients and families and caregivers, it makes me think of our work with Launch in the cancer space and how important that really is in understanding the experience of patients and families with cancer, and how having access, whether it's virtual to a clinic or to a support group or other services, is essential to high quality care for that condition. And that's true across many chronic conditions, as you well know. So as we go forward with our work in the task force, again, we're interested in making sure that the conversation about broadband connectivity goes beyond it being infrastructure only, that we think about it more broadly. We think about it in terms of access, adoption, and use as sort of the three facets of broadband connectivity, each of which in their own way have a value proposition. Does that trigger any other thoughts for you here in our remaining minutes that we have?
Yes, it does, David. Thank you. I've learned a lot from listening to Karen and the kind of viewpoint that the task force and the commission are having on this. I'm pretty excited by what Karen has taught me already in the short time I've learned from you. But I think the mentality change that I think the task force has and would encourage them to have is not to think of broadband as a way to automate the existing care models only. I think there's a new way to think about what health care, the pursuit of health is. Actually, I think that broadband, it is a technology, but it's also a platform for conversation about rather thorough redesign of the nature of care itself and of the pursuit of health itself. I know that's kind of vague talk, I guess, but I mean, let's get a new care system out of this, not just railroad tracks for the current care system. And I think that's really promising. We just explored one end of that. I'll say it again, and that's the feedback loops. So that I can't stay in a hotel now without getting a questionnaire by the time I'm back in my house saying, how did we do? What could have been better? All that. Healthcare needs to do that all the time, every encounter, every time we try to help someone, we hear back, how did we do? What did we learn? Where were we wrong? Where were we right? We can do that now. That's not the current system. That's a future system. And the other area of innovation we just talked about is connection to social determinants. Let's think pretty big here. How could healthcare help more effectively help their early childhood experience? How could healthcare eliminate, through broadband, eliminate loneliness for elders? How can we make every workplace a safer workplace? How can we really make nutrition in communities become a source of constant growth and development? These are questions that cannot be asked within the current system. They can in a highly connected system, I think. So we need to think not just about connection, but about redesign on the platform of connection.
Don, that you articulated so well the philosophy of our task force and the leadership of our task force, Michelle Ellison and Karen Omijek, that I have come to respect this much broader notion of a new system of health, not just a healthcare system, which we know is wrought with a lot of issues, and you've studied it your whole career and improved it in so many ways. But health can be so much more, and we think it is, and we believe that broadband connectivity will enable that going forward. And we want to think differently. I may be co-opting Steve Jobs and Apple, but it's come up several times in our conversations with our panelists that we have to think differently.
Yeah, what assumptions were you carrying that now can be relaxed? I have to give a shout out to Chris Gibbons. I heard him speak about this at Robert Johnson Foundation meeting about 4 or 5 years ago, and it was quite an experience hearing Chris, because that's what he was saying. This is a new game, a new enterprise at our doorstep if we'll take advantage of it, and it's very exciting.
Thank you, John. We have a minute or two left. Are there any parting comments or thoughts for the rest of our audience and the rest of our day? We've got a number of other panels that will dive deeply into research and into the technologies that are emerging and the like, and the implications. So any final commentary from you?
I guess 2 thoughts. One is, let's act with courage here. This is new territory, and if we ride the brakes, we won't get the benefit to populations, especially disadvantaged and poor populations, that we need here. This is time to go ahead and then study as we go. And by the way, that's a comment about global health. I know we're focused domestically here with the FCC, but everything we're saying is 10 times more important if we think about our citizenship in the global world. I think the other thing is, let's get out of our silos. We've built a healthcare system with guilds and restrictions and scopes of practice and licensure and regulation stuff that's now going to be in our way. And so we have to have the courage and the generosity to think across boundaries that we've nurtured for a long, long time. We built many fences. Now let's take them down. Because I think the advantages of using broadband to reach into social determinants, for example, or to actually democratize access, that it will threaten legacy regulations, legacy thinking, legacy guild structures. And I just say, let's go for it. Our job is to help people live longer and better, and we can't do it within our silos anymore. And broadband should be a vehicle for tearing down those walls.
Don, that was just poetic. And I will always remember now, democratize excellence in care as another lesson from you that I've learned, and how important that will be. So I want to thank you for your time and the opportunity to chat with you, and look forward to seeing you again, hopefully in person at some point soon. And thank you again for participating.
Thank you. It's a pleasure to see you and work with you. Congratulations to you and the task force on what you're doing.
Thank you so much.